Good evening. It's Dr. Chris Lauria from Disc Centers of America in Roanoke. It's been a couple weeks because of the holiday and all that since we've done one of these live streams, but I wanted to get on to you tonight on the line tonight and talk to you a little bit about a question I always get in my office. What we're doing for those people who are on this, you can submit a question to our office, send us an email with something you'd like me to go over regarding treatment for your back, neck pain, sciatic pain, leg pain, anything to do with your spine. If you have a question, something you've heard, something on an MRI or diagnosis or something that you'd like me to cover on this live stream, I'd be more than happy to do it. Just going to give us a couple of minutes or a couple more seconds here to allow some more people to get on. We've had more people join our page, so hopefully more people are going to be live. If you have a question, you can ask it during this live stream too, and I can go over that. So yeah, there's a couple more folks, so that's great. All right, well, let's get started. Don't like to keep people too late, but anyway, the question I always get in our office, and I've gotten this for years in treating this. I actually someone commented the other day on one of our posts was that, well, this is just traction. Um, and the question always rises, what's the difference between spinal decompression therapy and traction therapy? And there's a really a large difference. And it's one reason why the success ratio with spinal decompression is so much higher with people who have problems with degenerative bulging, ruptured, herniated discs in their spines is because of the difference between spinal decompression and traction. And we all know what traction is. We've seen it. You've seen people that use things that hang over your door frame that kind of pulls your neck. We've seen people laying on tables with weights hanging off the end of the table, just pulling and stretching the spine. That was actually done in hospitals in the past years ago. But there's a lot of rudimentary and there's a lot of traction tables, and the goal of traction is basically is just to, and this is a model of two vertebrae of your spine, is just basically just pulls the spine apart, okay, um, and stretches the spine, so to speak. And it can be very beneficial in people with maybe muscular problems and things like that. And it was beneficial and does have some help and positive effect with people with disc problems. But only so much can be done with traction because in that type of treatment protocol, you're pulling against muscles that are guarding a problem, okay? And just pulling the spine apart can create more tension in those muscles over time. And it doesn't really anything do anything specifically for the disc problem itself, but it was used for years. And it's still used today to help certain conditions. For people with healthy spines, pulling the spine apart, tractioning, those type of things can be very beneficial in helping their spine remain healthy and help to provide loosening of the muscles and those type of things. The true difference is with spinal decompression. Decompression is a treatment which pulls and relaxes, pulls and relaxes, pulls and relaxes. It pumps the disc. And whenever you pump something, it sets up a pressure gradient. That means there's higher pressure on the outside than the inside. So it creates this pressure difference, and it's kind of like a vacuum. As you pump something, it'll suck the disc problems back into the normal space again. Bulges, herniations, those type of things. It'll also allow fluid and oxygen to re-enter the disc. So we're creating this intradiscal pressure to actually um, help the disc problem reduce and also allow fluid and oxygen to help reduce the disc. And that obviously will help with the pain, the symptoms of things that people are having there. Now, the other thing about a decompression table, and when you get the more advanced machines like the DRX 9000, the AcuSpina, those type of things, is the decompression pull is actually be able to set up at very specific angles to focus it best it can on a specific disc. So if you have a L4 between lumbar 4 and 5 disc bulge or herniation, we're able to set the angle of the machine to focus on that disc as much as we can. The other thing that the advanced decompression machines are designed to do is there's a logarithmic curve, meaning the decompression machine is constantly measuring how your body's responding to the decompression. And if the muscles are fighting this pumping of the disc, the decompression machine is going to modify the treatment to allow it to get to a level where your muscles aren't fighting it. True decompression cannot happen if the muscles of your back are guarding and protecting the disc problem. If that's going on, it's not going to be able to pump that disc. So with the machines, we're able to set it at a very specific weight for the specific disc we're working on to allow the muscles to relax so the decompression can go on. If the muscles start to fight and to resist what we're doing, the advanced decompression machines, DRX 9000, Acuspina, are able to make specific changes and alterations to the treatment to allow it to go back to treating the disc without the muscles are fighting. And it doesn't have to be something that's manually done. These decompression machines are so advanced. There's multiple computers in each system, and there's different motors that allow these type of changes to happen if your body is resisting the decompression. Again, traction is unable to do that. It's set at a weight, it's pulling the spine apart. It isn't able to recognize the muscle fighting, the muscle balance, the resistance your body's uh, giving to the amount of pull that's there. Number one. Number two, it can't be set at a specific angle. And then lastly, it's not able, it doesn't pump the disc and create that pressure gradient that true axial spinal decompression does. So if you're having problems and you have some kind of disc problems, degeneration in your neck and back, there are traction type machines that you can buy online. Again, there's a risk in that because they're not specific. You don't have a correct diagnosis. You don't know exactly which disc you're working on. And you're not able to monitor how your body is actually responding to decompression. So I would urge you to be careful with those type of things, and just go real slow because done the wrong way, it can actually cause more damage to the spine. So if you're having these type of problems, you've been utilizing traction or some kind of traction, rudimentary traction machine to help, and you'd like to get to the root of the problem, figure out exactly what's causing the problem, you can set up a consultation in our office. Um, we will do testing to determine if you're a candidate for decompression treatment. Once we do that, we will develop a different specific care plan for your case, depending on which discs are affected, whether it's a bulge, whether it's a herniation, whether it's degenerative disc disease, how many discs are affected, and we will develop a care plan to help those problems get corrected as best we can once we determine if you're a candidate. Decompression isn't anything you just put someone on to test to see how it works. There's specific studies, there's lots of research to determine the validity of spinal decompression and how it's supposed to be used in order to correct these problems, and we can provide all the information on that. You can go on our website, www.roanokedisccenter.com. There is tons of research in there explaining what true axial spinal decompression is, and there's also great research on explaining the difference between tractioning. So if you want to set up a time to come in our office, you can look at the bottom of the screen here. There's a telephone number, 540-600-4630. We can set up a complimentary consultation. I will do very specific orthopedic testing. I will do neurologic testing. We have a specific machine which is able to measure nerve and muscle function in your back and then review your MRI. That's what's going to let us know whether or not you can be helped by spinal decompression therapy for the specific condition that you have in your neck or back. Okay. So again, it was great to be on again tonight. I'm Dr. Christopher Lauria from Disc Centers of America. And again, if you have any questions, anything you'd like for me to go over on this podcast, you can just go ahead and send us an email to that website that I put up before, and we can answer those questions. Until next week, thank you very much. and you guys have a good evening and try to stay warm. It's pretty cold out there.